All right, good afternoon, and thank you all for joining us today for the Department of Public Health media availability. Dr. Frere will give us a situational update on COVID-19 throughout the county, and then we'll take your questions. We will then make remarks in Spanish, and that'll begin at 3 o'clock. If you would like to be put into queue to ask a question, please click on the hand icon, which is in the participant panel, or you can send me a chat. I'm the host of the call. And with that, I'll turn things over to the Director of Public Health, Dr. Barbara Ferrer.
Thanks so much, Tim, and thank you everyone for joining me for today's briefing. This afternoon, I'll be talking about our trends in cases, hospitalizations, and deaths, both by race and ethnicity and by age group, and I'll provide information about vaccination coverage, post-vaccination infection cases, pediatric infections, and back-to-school safety. We can go to the first slide. I'm sad to report 19 additional deaths today. At least 12 of the people who died had underlying health conditions. And among the deaths we reported yesterday and today were a child under 12 with an underlying health condition and 2 young adults in their 20s, also with underlying conditions. This does bring the total number of deaths to 24,739 across the county. Our hearts and our prayers go out to the parents of these young people who have passed away, and we share our deepest condolences with all those who have lost friends, loved ones, and family, and we're wishing you healing and peace. We're reporting 3,672 new cases today, and that brings the total number of cases in LA County to 1,315,313. Our daily average case rate without the 7-day lag is now 21 cases per 100,000. That's a slight decrease from last week's computed case rate of 24 cases per 100,000. Although today's rate will likely change somewhat over the coming days as additional test results are reported, this does suggest to us that our rise in cases may be a leveling out. To date, more than 7.4 million people have been tested and had test results reported in LA County. I want to note that as schools and institutes of higher education return to sessions and their routine testing programs come back online, we should expect to see hundreds of thousands more test results each week. And in parallel with more testing, we should anticipate increases in our case numbers. Our daily test positivity rate dropped to 4.7%. This is a decrease of more than a full percentage point from last week's rate of 5.8%. There are 1,279 people currently hospitalized with COVID-19. This is an increase of over 360 people from the past week. There are currently 213 open investigations at our residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. And this is, again, a significant increase in just the past week. We can go to the next slide. As you can see from this table, it shows the CDC indicators and thresholds for community transmission of COVID-19. Transmission in LA County remains at the high level. Our case rate, as we noted earlier, is at 21 new cases per 100,000 residents. And this was about a 12% decrease from last week. We'll take the next slide. While we're still experiencing, a significantly high case rate, a little more than 2 weeks ago, at the time of our recent health officer order requiring universal masking indoors, we also noted that our cases had doubled every 10 days. What we're seeing now is a much smaller increase in our cases over a couple of weeks, which is what we're hoping for 10 days after implementing an effective public health measure. And this does serve as a reminder to all of us that masking remains an effective way to reduce transmission. It's also valuable to compare trends in LA County with those in the rest of the state after our county became the only one for a while with an indoors masking requirement on July 18th. When we compare cases that occurred in the week ending July 25th with those that occurred in the week ending August 1st, LA County went from seeing a little over 16,000 cases to seeing almost 20,000 cases. That was an increase of about 22%. Meanwhile, in the remainder of the state, reported cases went from about 29,400 during the first week to over 46,000 the second week. And that's an increase of 57%. Although there may be reasons contributing to these differences beyond the masking, data from around the world and from our county have repeatedly shown that masking is a valuable layer of protection against transmission of respiratory viruses. And I'm really grateful to everyone who's doing their part by masking up to slow the spread. We'll take the next slide. This graph shows trends in cases, hospitalizations, and deaths in our county from the beginning of the pandemic through July 28th of this year. Cases, which are represented by the green trend line here, have been reported at an average rate of about 2,750 cases a day for about the past week. And as you can see, looking at this trend line, cases may have begun to level off. Hospitalizations, as you can see on this graph, rise as a lagging indicator compared with cases, usually increasing 2 weeks after we begin to see significant case increases and multiplying almost in direct proportion to cases. We're not currently seeing that pattern replicate itself during our current surge of cases, although cases have increased by about 550% over the past month. Hospitalizations increased by about 290%. And while the number of people dying from COVID remains relatively low, our 7-day average number of deaths unfortunately did double in this past month, from 3 daily deaths to 6 daily deaths. Given that just about every death is preventable, these losses are particularly tragic. You can go on to the next slide. As we've noted for the past couple of months, increased circulation of the highly transmissible Delta variant is leading to significant case increases across all racial and ethnic groups. This slide shows case, hospitalization, and death rates by race and ethnicity from the 2-week period ending on June 26th, alongside these same metrics a month later for the 2-week period that ended on July 24th. In keeping with our trends recently, over the month preceding July 24th, all groups saw huge increases in cases, with the highest case rate continuing to be experienced among our Black residents, where the case rate rose from 71 cases per 100,000 people to 426 cases per 100,000 people. This is an increase of about 500%. The case rate among white residents increased 850% to reach 228 cases per 100,000 people, while cases rose over 700% among Asian residents to reach 89 cases per 100,000 residents. The smallest increase was 170% among Latinx residents, where it went up to a case rate of 169 cases per 100,000 residents. We continue to be deeply alarmed to see the case incident rate in Black residents be so much higher than the rate for all other groups, and it's more than 2.5 times that for white residents, which is the group now with the next highest case rate. We're hopeful that the most recent decline in the rate of case increases will be reflected in our upcoming case rates for early August. Over the same interval, the rise in hospitalization rates has also accelerated, now rising fastest among white residents, who saw a 300% increase to a rate of 11.7 hospitalizations per 100,000 people in late July. Among Black residents, hospitalizations increased by 225% to about 37 hospitalizations per 100,000 residents. This is the highest rate among all groups. Hospitalization rates also rose by 110% among Latinx residents and 150% among Asian residents. Meanwhile, as you can see, death rates have more than doubled in all groups, with the exception of Latinx residents. You can go on to the next slide. When we look at this data by age group, we also see case increases across the board. This slide shows case, hospitalization, and death rates by age group for the same 2-week periods as on the previous slide. All groups saw increases in cases, with the largest and highest increase again among 18 to 29-year-olds, whose case rate rose nearly 8-fold to reach 476 new cases per 100,000 people. Hospitalization rates also increased 2 to 3-fold in all but the youngest age group. And death rates increased, but fortunately they remain relatively low. You can go on to the next slide. The surging numbers reflect, as we've noted, the reality that the Delta variant now accounts for nearly all the COVID strains seen among sample sequence in the Los Angeles County area. Last week, comprising 96% of all strains, as you can see indicated by the blue line on this graph. As we know, the Delta variant is more efficiently transmitted between people, likely due to its faster replication, higher viral load, and greater affinity for lower respiratory tract cells when compared to earlier COVID strains. And while emerging data continues to affirm that fully vaccinated people are well protected from severe infections with Delta variants, small numbers of fully vaccinated people have become infected, and they're clearly able to infect others. Given that the Delta variant is more easily spread, common sense precautions are appropriate, and adding in extra layers of protection makes the most sense. This includes masking, distancing, and avoiding very crowded settings as much as possible. Unvaccinated people need to be particularly careful, and they should avoid high-risk activities and wear respirators if their work or an activity requires that they be in close, sustained contact with others. We'll go to the next slide. Given the increased evidence that fully vaccinated people are getting infected, we do continue to share information each week on vaccine effectiveness and how to use this information to best keep ourselves and others safe and to get back to slowing transmission. This slide shows data for those fully protected by the vaccines to scale. The large green box represents the more than 5 million residents who are fully vaccinated. The tiny purple box in the left lower corner of this box represents the 15,628 fully vaccinated people who tested positive for COVID as of August 3rd, 2021. This is an increase of 47% since last week. Of those who tested positive, and again, that's less than 1%, of those who tested positive, 446 were hospitalized. This is an increase from 410 the week prior. This translates to a rate of 0.009% of all fully vaccinated people ending up hospitalized. Deaths in this group over this interval also increased very slightly from 35 deaths to 41. And that means that the percent of people fully vaccinated who have passed away is 0.0008%. These small increases, while indicative that fully vaccinated people do become infected and that more have become infected during the summer surge than before, still provides compelling evidence that fully vaccinated people remain at very, very low risk for becoming infected and even lower risk for having a bad outcome if they are infected. We can go to the next slide. It's particularly helpful to view the low risk to vaccinated people in comparison with the risk to unvaccinated people. Over the next few slides, I'll be showing data comparing cases, hospitalizations, and deaths among fully vaccinated and non-fully vaccinated residents in LA County. The case rate among non-fully vaccinated residents are nearly 4-fold higher than the rate among fully vaccinated residents, as you can see here. The next slide. This slide shows similar data by age group. Here, case rates among unvaccinated people are again represented by the orange lines, while rates among vaccinated people are again in green. Rates in adults between the ages of 18 and 49 are represented by solid lines, and rates in adults age 50 and over are represented by the dashed lines. Note how dramatically case rates are differing both by vaccination status and by age group. The highest rates are among unvaccinated or partially vaccinated adults between the ages of 18 and 49. And you can see that in the orange, the solid orange line. The next highest case rates are among unvaccinated or partially vaccinated older adults, represented by the dashed orange line. And below them, vaccinated younger adults in the solid green line, have, as you can see, much lower rates. Without vaccination, the orange lines on this graph would likely be 60 to 100% higher. So we're extremely grateful to everyone who's helped reduce potential transmission by getting vaccinated. We can go to the next slide. On this slide, you can see data from a new analysis that we conducted that shows age-adjusted hospitalization rates among fully vaccinated people. That's represented by the green line, and non-fully vaccinated people represented by the orange line. Between May 1st and July 17th of this year, 3,158 people were hospitalized. Only 8%, or 251 people, of whom were fully vaccinated. As you can see, the hospitalization rate is rapidly increasing among unvaccinated people, while it remains extremely low among vaccinated people. The risk of hospitalization is 19 times higher in LA County among people not fully vaccinated than it is among fully vaccinated people. The next slide. When we look at age groups, when we look by age groups at who is now getting hospitalized, we can see that the highest hospitalization rate is among older, unvaccinated adults, represented here by the dashed orange line. These are our highest risk residents, likely because of their age, that they may have comorbidities, and that they lack vaccine protection. And sadly, hospitalizations in this group is rising very quickly. Hospitalizations in younger unvaccinated adults, represented here by the solid orange line, are also rising. Relative to those, hospitalization rates among vaccinated adults of all ages, again, remain nearly flat. Trend lines like these are why we feel so certain that the vaccines are doing exactly what they're supposed to be doing across LA County. Vaccinated people are exceptionally well protected from hospitalization. And while we've seen cases rise among vaccinated people, their experience of COVID is worlds away from the severe illness the infection continues to cause in unvaccinated people. This is why we're asking everyone eligible to get vaccinated. Almost all COVID hospitalizations and deaths are preventable. There wouldn't be so many families experiencing sadness and fear because their loved ones are hospitalized with COVID, and almost no one would pass away from COVID if everyone was getting vaccinated. Next slide. There's a lot of interest in better understanding the population of vaccinated people who are hospitalized for COVID. The best way for us to fully characterize this population would be to review the charts of everyone hospitalized for COVID. And that's an extremely time-consuming task that we do have our epidemiologists working on those chart reviews. But in the meantime, we're looking at some other data to give us a clearer picture of the situation. One data set we recently analyzed is what we call our discharge diagnosis codes, or the discharge diagnosis codes that are assigned for all fully vaccinated people with a positive COVID test while they were hospitalized. And this is as of July 25th. These are codes that are issued for every single hospitalized patient for the most part. And they include what are called the primary and additional diagnosis in order of relevance to each patient's hospitalization. As you can see, the data suggests that among the 341 fully vaccinated hospitalized individuals for which we had these codes, out of the 410 post-vaccination hospitalized patients, 24% did not have COVID listed as a diagnosis, which suggests that they tested positive for COVID on admission to the hospital, but this positive test had no relationship or bearing on their hospitalization. Among the remaining patients, 25% had COVID listed as their primary diagnosis, suggesting that COVID was the cause of their hospitalization. Another 51% listed COVID as one of the diagnoses, which is likely to mean that COVID was a contributing factor in their hospitalization. We'll continue to share information about vaccinated people who are hospitalized with COVID infection as we learn more. We can go on to the next slide. Because we're very interested in understanding how well vaccination protects against these severe outcomes from COVID, we also are closely following differences in deaths between fully vaccinated and non-fully vaccinated people. In people who die of COVID throughout LA County, An average of 37 days pass between the date that they're diagnosed and the date that they pass away. With our case increase having begun so recently, it's really too early to assess the full impact of this latest wave of infections on COVID death rates. Nevertheless, I want to be able to show you what we do know about deaths due to COVID by vaccination status. As this slide shows, between April 1st and July 18th of this year, over 95% of all COVID deaths among LA County residents, this is 551 deaths in all, took place among unvaccinated or partially vaccinated people. And there were 28 deaths, it's almost 5%, that occurred amongst fully vaccinated people. So you can see the number again is really, really low, and again, mounting evidence that these vaccines really provide the kind of protection we were hoping for against serious illness and death. We'll go on to the next slide. Given the high rate of community transmission, our vaccination efforts remain critically important to reducing the impact of rising infection on our residents. As of August 1st, we've administered more than 11 million doses to residents 12 and older, including more than 6.1 million first doses and nearly 5 million second doses. This means that more than 6.2 million LA County residents have received one dose, and nearly 5.5 million residents are now fully protected. We can go on to the next slide. This slide shows how we're doing at vaccinating specific age groups of LA County residents. As of August 1st, we vaccinated 90% of LA County residents 65 and older, 72% of residents 16 and over, and 71% of residents 12 and over. We vaccinated 53% of LA County teens between the ages of 12 and 17. And out of our nearly 10.3 million LA County residents, including those not yet eligible for the vaccine, 61% have received at least one dose, and 53% are fully vaccinated. We can go on to the next slide. And we've now seen an uptick in our first dose recipients for the third week in a row. Between July 26th and August 1st, we administered 81,241 doses across the entire county network. And this is another increase of more than 7,000 doses from the previous week. We remain immensely grateful to everyone in this county who has done and continues to do their part by getting vaccinated. It is a tremendously important time for people to get vaccinated, so we're grateful for these signs of increased vaccination uptake. We can go on to the next slide. With these increases in vaccination countywide, we're now seeing bands of higher vaccination rates, represented by dark green on this map, across southern and western neighborhoods of the city, and parts of the San Fernando Valley, and in East LA and beyond. In the last 2 weeks of July, just about every city and community in the county had an increase in vaccination coverage. 40% of the cities and communities with the biggest leaps upward were in central and south central LA. Some cities and communities had particularly high increases in vaccination coverage, with some increasing their vaccination rate more than 4% over this 2-week period. I do want to shout out and thank some of the neighborhoods that mobilized for this remarkable achievement. So to the residents of Little Armenia, El Monte, Roosevelt, Westchester, Rosewood, West Rancho, Dominguez, Sun Village, Llano, High Vista, and East Hollywood, all of LA County is thanking you for doing your part to reach community immunity. We can go on to the next slide. Although we continue to have large gaps in vaccination between age and racial and ethnic subgroups, there are promising upticks in many of the groups with lower vaccination coverage. The numbers on this slide are now color-coded to show changes over the past week. Proportions that increased by 1 point over the past week are listed in blue. Those that increased by 2 are listed in green. Those that increased in 3 are listed in pink, and those that increased by 4 are listed in red. Proportions that didn't change are in white. And the good news is that there's almost no white on this table. However, disproportionalities remain, especially among teens and young adults. Among both the 12 to 15 and the 16 to 17 age groups, about 1/3 to 1/2 as many Black and Latinx teens, and about 2/3 to 3/4 as many white and American Indian Alaska Native teens are getting vaccinated when compared to Asian teens. However, with the start of the school year approaching, we're glad to see significant increases in vaccination across racial and ethnic subgroups in teens ages 12 through 17. Meanwhile, among young adults 18 to 29 years old and 30 to 49-year-old residents, we saw increases among most racial and ethnic subgroups this past week, and we hope to see these rates become more comparable in the near future. Looking at totals by age group running across the bottom of this table, you'll note that all age groups, with the exception of 12 to 15-year-olds, are now vaccinated at a rate of 60% or higher, and this is a great step towards community immunity. We're particularly gratified that so many of our seniors are protected by vaccines. And while we applaud the rising vaccination rates among the younger adults who are at the heart of our workforce, they still face a lot of risk, and there are a lot of gaps to close. If you look at the totals in the rightmost column, you can see that the groups with the highest rates of transmission, hospitalizations, and deaths continue to have the lowest levels of vaccination. With transmission continuing to be high, we do remain very concerned about these lower levels of vaccination among our Black residents and other teens and young adults. However, I am hopeful that the increases we're seeing on this chart continue to add up until we see high rates of vaccine coverage across the board. In the meantime, complying with the indoor masking requirement does help us get back to reducing community transmission rates while vaccination rates increase. Slowing the spread not only protects vulnerable unvaccinated residents, it also, as we've noted over and over again, it also does reduce the chances of more mutations that can result in more infectious variants that evade our vaccine protection. Next slide. As our county's children begin returning to school this month, I'd like to update you on how the latest rise in transmission has played out among our younger populations. On this slide, you can see trend lines showing case rates in 3 pediatric age groups. As you can see, the age group with the lowest rates of transmission continue to be children between the ages of 0 and 4, and that's represented here by the blue line. Cases are rising faster and to higher levels among older children. Children aged 5 to 11, represented by the orange line, and those 12 to 17, represented by the green line, have similar case rates. You may note, if you look back at the distribution of cases among these age groups during our wintertime surge, that children in the oldest age group had rates quite a bit higher than those of younger children. With this age group currently the only pediatric age group eligible for vaccines, we may now see that transmission within this older age group has been blunted significantly. We'll go on to the next slide. On this slide, we've broken out the case, hospitalization, and death rates that you saw earlier by smaller pediatric age groups. And while rates are relatively low across the board, you can see all age groups experience 5 to 6-fold increases in case rates between the end of June and the beginning of July. We've also seen rising hospitalization rates among younger populations, with a nearly 4-fold increase to a rate of 2.3 hospitalizations for every 100,000 children aged 0 to 4, a 2-fold increase for the rate to the rate of 0.4 per 100,000 children aged 5 to 11. Fortunately, we did not see increases in death rates over this time interval. I will take the next slide. We're also, as everybody knows, we've tracked outbreaks in schools over the course of the past year, and this includes outbreaks in youth sport programs. As this slide shows, outbreaks rose to a peak of 16 per week over the winter surge, and then dropped and remained low during the spring and throughout most of the summer, up until our recent increase in cases. It's important to note that between April and July, more than half of the outbreaks we saw were associated with youth sports. Of the 7 outbreaks that we recorded this past week, 4 were associated with youth sports. We can go on to the next slide. While investigating these outbreaks, we've noted some important factors that are associated with transmission in school and youth sports settings. In schools, inconsistent mask wearing, lack of social distancing, especially while eating and drinking, mixing large numbers of students, and not excluding symptomatic individuals was associated with in-school transmission. In youth sports, increased risk was also conferred by inconsistent mask wearing during practices and games, as well as by socializing outside of games and practices, traveling and lodging together during training camps and athletic events, and underreporting and not excluding close contacts from athletic team competitions and activities. To reduce outbreaks, we recommend moving indoor sports outdoors to the greatest extent possible. As a reminder, masks are required at schools during indoor practices, games, and indoor activities. We can go on to the next slide. We did recently revise and post our K-12 school reopening protocol. I want to thank all of the superintendents. I want to thank the LA County Office of Education and LAUSD for all of their help and support in drafting these reopening protocols, as well as our labor partners. These are some of the changes that will be in place when LA County's children return to school. Face coverings will continue to be required indoors for everyone, regardless of vaccination status. And this includes during indoor PE classes. The only exclusion for this is when a person is alone in a room. Students who are exempt from mask wearing because of a documented disability or other medical condition should not be excluded from in-person education, and appropriate accommodations can get made on a case-by-case basis. Students who are excluded from the campus because they elect not to wear a face covering should be offered alternative educational opportunities. We continue to recommend physical distancing as long as it doesn't interfere with full-time attendance for all students, and infection control remains essential. Many schools have established routine testing programs to provide an additional layer of protection. All unvaccinated students and staff should be included in this routine testing, and if resources are sufficient, fully vaccinated individuals can also be tested. Every school will have a plan on how to manage cases and outbreaks, and they're required to notify the public health department whenever there are cases. And the public health department has a team of especially trained staff that will work closely with the schools to monitor cases and respond to any outbreaks. All positive cases are required to isolate, and all close contacts of each case should be tested and are required to quarantine unless they are fully vaccinated and without any symptoms. If you're a close contact that's fully vaccinated and you have no symptoms, you are also required to monitor yourself for the full 14 days after your exposure to make sure you don't develop symptoms. If you do develop symptoms, you need to get tested again, and if you're positive, you need to isolate. We now require that when testing is needed, as in the case of either regular testing programs or outbreaks, all people should be considered for testing regardless of their vaccination status. This is particularly important for outbreak testing. We want to note that if you have mask exempt employees, please go ahead and test them twice a week. We can go to the next slide. Our high schools and our middle schools are planning more than 135 vaccine events countywide in August. Many are occurring during student registration sessions in the first half of this month. These events are open to students, staff, teachers, parents, and in many instances, community residents. The map shows the schools where these vaccine events are taking place, and you'll note that many of them are located in hard-hit neighborhoods that are marked here in pale green. Because vaccination is such an important part of our strategy for keeping schools safe, we do encourage everyone eligible for a vaccine to go ahead and get vaccinated. If your school is not hosting an event, please encourage them to reach out to the LA County Department of Public Health so that we can go ahead and help coordinate a vaccination event in this next month. Now I'll go on to the next slide. Preventing COVID transmission in schools requires layering in a variety of protections that everyone needs to support. Vaccinating everyone eligible is the first critical step to reducing risk. Consistent indoor masking of everyone 2 years and older is also a key component of prevention. We've asked schools to continue maintaining a safe physical distance between students whenever possible, since this reduces overcrowding and transmission. Infection control measures, including hand washing and cleaning and disinfecting commonly touched surfaces, remain important measures, while ventilating rooms and conducting eating, drinking, and other activities outside as much as possible also contribute to lowering the risk. Where possible, particularly among younger groups, we recommend that students remain in stable cohorts that stay together throughout the day in order to limit transmission in the event of an infection. Testing programs are able to screen people for infection before they show symptoms. So this helps stop the spread of infection by identifying those who should be isolated or quarantined early on. And it also allows schools to implement a robust case and outbreak management strategy. Schools and staff members who feel ill should always stay home. And when needed, you should consult with your healthcare provider to find out if you should be tested or you require additional care. We can go on to the next slide. We recognize that given recent increases in cases, there is anxiety around school reopenings. And while schools have been working closely with us over the summer to create environments that promote safety, there are steps that parents and caregivers and students can take to help make back to school as safe as possible for everyone. State and county protocols currently require universal masking when indoors on all school campuses. And schools also have their own individual set of protocols and procedures. Communicate with your school ahead of time, with your child's school ahead of time, so that you can help ensure you're prepared to help keep educators and students as safe as possible. Talk to your kids before they go back to school about hand hygiene and appropriately wearing their mask. It's a good idea, particularly if you have younger children, to send them to school with extra face coverings so they can easily change masks if theirs get wet or dirty. Ensure that you have a strategy at home for checking daily for symptoms. And as best you can, have an emergency child care plan in place so that if your child becomes ill or they're required to quarantine, they're able to safely stay home from school. If any of your children are 12 or older, please let them know about the importance of getting vaccinated and help get them to a vaccine site. In addition to the school events that are being supported at so many campuses, we continue to offer Pfizer vaccines to children 12 and older at all county and city sites. And these vaccines are also available at many other sites, including pharmacies across the county. We also note that over the past year and a half, many children have fallen behind on their routine childhood vaccinations. If your child missed regular doctor visits or you think your child might be behind schedule, please reach out to their pediatrician or their clinic and get them caught up before the school year starts to reduce their risk of other preventable childhood illnesses. And just as a reminder, teens between 12 and 17 are eligible for just the Pfizer vaccine. And that's a 2-dose vaccine given 3 weeks apart, and your children will be considered fully protective 2 weeks after their last dose. As schools reopen, I know so many of our students and parents and teachers and staff are eager to be part of the movement to educate others in your community about COVID vaccines. Next week, parents and students can be part of our student and parent ambassador programs. These programs educate and empower students and parents as essential partners in each school's prevention efforts. For more information, you can scan one of these QR codes on the slide or visit one of the links that's listed here. Thank you, and now I'll take your questions.
And as a reminder, if you have a question that would like to be put into queue, please click on the hand icon that's in the participant panel. And our first question will come from Patrick Healy with NBC News.
Hi, Dr. Ferrer. Let me ask you about this tantalizing prospect that this current surge may be cresting. Is it fair to say that the significant factor in this is the early adoption of masking indoors? And given what you're seeing on the ground now, will you consider requiring vaccination for indoor events, a la New York and what the city of LA is considering? Or do you feel that best left to the private sector's judgment? Thank you.
Yeah, thanks so much. Both questions are really important. We showed some data that definitely at this point indicates, we're not seeing the exponential growth in cases we saw earlier. And we look different in terms of the rate of increase here in LA County when compared to other counties across the whole state for the 2 weeks at the end of July, which is one of the big differences between us and other counties was we were the only county at that time that mandated indoor masking. It's hard to say with 100% certainty that this was the factor that tipped us to have a slightly better slowing of spread than other places. But I know for sure it contributed, just because the data is really conclusive on the importance of masking indoors and how that does in fact reduce transmission. I also want to note that I think many people took additional precautions, and that contributed as well. I think people avoided very crowded situations. I think for some people and some businesses, they changed practices to create as much safety as possible. And as you noted with your second question, some of that was actually requiring that people that come into settings where there's higher risk, they're indoors and people may be unmasked for some part of the time that they spend indoors. We've had businesses go ahead and require proof of vaccination in order to come inside. And so again, I think all of that helped for sure on getting us back to trying to slow the spread. We have a long ways to go. One issue that I alluded to early on in my comments is as we introduce more required testing of unvaccinated people, and in some places it may even include vaccinated people, schools and universities being some of those sites, we're going to see more cases, and that's to be expected. 2 weeks, we've gone from about 40 to 45,000 tests a day to close to 60,000 tests a day. I do also want to note that the test positivity has dropped slightly. We'll have to see if this continues. And that's also an encouraging sign that says that perhaps transmission, while still high, because you saw our numbers, it's still extraordinarily high, may be getting back to slowing down. And I thank everyone who's doing their part, because that's the only way that happened. In terms of requiring proof of vaccination as entry into certain activities, I want to applaud again cities that are considering this measure, all of the businesses that are considering this measure. I know that there are conversations that we're having with both the Board of Supervisors, businesses, and labor partners about what are sensible practices that the county can support, as again, we all work towards the same shared goal at this point of ending this pandemic. So thanks for that. And I'll take the next question.
That'll come from Luke Money with the LA Times, and his microphone's not working, so he wrote it to me. He says, last night in a briefing for parents at the school's town hall, you had explained that 3 cases at a school would be considered a potential outbreak and trigger contact tracing and evaluation. But parents are concerned about being left in the dark and not having a clear understanding of what would trigger an aggressive response to an infection. Is there a county protocol in place to shut down a classroom or a school?
Yeah, it's such a great question. And just for clarification, every single case that's identified, not just in a school, but anywhere in LA County, we do our very best to interview those cases and absolutely isolate, issue an order for the case to isolate, and we start our contact tracing. So I want to say that applies for schools as well. And every single case at a school is reported to us so that we can make sure that, in fact, we're isolating cases as soon as possible and being aggressive about all the contact tracing. Outbreak management kicks in when there are 3 or more cases that have been identified as being linked over a 14-day period in a school environment. And that to us indicates the possibility of transmission in the school environment. Cases can come, especially if you're doing a lot of testing, cases can happen anywhere. People can get infected at home, out in the community, at work, and then bring that infection into a school environment. So outbreaks for us really mean that there's a possibility that we're seeing transmission at the school, in the school environment, among members of the school community. And that is, as parents noted last night, means that there needs to be additional support from us here at the health department. We're the ones who will determine whether it is an outbreak. We're also the ones that will work with every school where there is an outbreak experience to determine what's the safest way for us to reduce exposures in that school. We don't anticipate closing lots and lots of schools just because there are 3 cases. That would not make sense. It's not what we do with other infectious diseases, and many parents are familiar with other kinds of outbreaks that have happened in schools. What might be more likely is if there's a classroom where you have those 3 cases, everybody in that classroom who isn't infected is a close contact, and that entire classroom, may need to either be in isolation or in quarantine for a period of at least 10 days. So those are, I think, the more likely scenarios about managing outbreaks in schools. I mean, we have all seen across other parts of the country, fortunately, never here in LA County to date, schools that experience hundreds and hundreds of cases. And in those situations, those schools needed to close. So again, the good news is we're training all the school nurses. We've worked all summer with school administrators. We talk frequently with all of the labor partners. And I think we have really good processes in place that allow for a very strong partnership between the public health department and the schools to really manage both cases and outbreaks so that we minimize exposures as much as possible to everyone in the school community. Thanks, Lou.
Next question. The next question will come from Claudia Pesciuta with KNX.
Hey, so with testing expected to go up dramatically as school resumes and more employers require regular testing, do we have enough capacity to handle that? Excuse me. And if not, what's being done to prepare for that? Also, do you think that, the New York City plan that kicks in on the 16th and the proposal that LA is considering would require only proof of partial vaccination for indoor activities? What do you think about going with just partial vaccination, given that research shows that partially vaccinated people are less protected? Thanks.
Yeah, thanks for both questions. In terms of sort of planning for, additional needs to be able to meet what you noted is accurate, the increased demand for testing. I know that DHS, which really operates the community testing sites, is already looking at where it may need to add capacity, working very closely with the state as well to help businesses access some of the state resources around testing. We have a lot of labs here that are available for testing. And for schools, both the LA County Office of Education is supporting testing processes for all of the school districts that have signed up for testing to, implement routine testing. And here at the Department of Public Health, we've partnered with Fulgent Labs to support all the private and parochial schools that are engaging in routine testing. So, there's a lot of planning obviously going on. And, DHS will constantly, as it has done throughout this entire pandemic, ensure that there's good capacity and good access to testing as needed during this next phase of the pandemic. I want to also note that we have plans in place to augment the contact tracing staff again, should we see large increases in the number of people that test positive, because the whole purpose of testing is to be able to interview those cases, find out who their close contacts are, and make sure that both cases and close contacts are not circulating amongst others, to pass on the infection. In terms of the question about the city's ordinance or proposed ordinance for requiring that folks entering certain establishments show proof of at least one dose of the vaccine. I do want to note, you're absolutely right, Claudia, that in order to have a lot of protection, you do need both those doses. We wouldn't want anybody to think that one dose is sufficient, since there's so much evidence now that you don't have a lot of protection with just one dose. But I also want to note that consistently throughout the pandemic, since we've begun vaccinating folks, over 91% of people who get their first dose get their second dose on time. And while other folks are late and delayed, and some folks, you're right, don't come back in, the vast majority of people do end up getting fully vaccinated. So I would just hope that, we use that science. Your best protection is to be fully vaccinated. That's one dose of Johnson & Johnson or 2 doses of Pfizer and Pfizer or Moderna. And for all the 3 vaccines, you need to wait 2 weeks after your last dose to have that full protection. But thanks for that. And we can go on to the next question.
Okay, and this will probably be our last one. It'll come from Jackie Fourier with KCPP.
Yeah, KPCC. I'm curious, Dr. Ferrer, if you think California as a whole should reinstitute an indoor mask mandate given the data that you reported today.
I think, the state has a very different set of responsibilities given the variability across counties. What we try to stay very focused on here is, what does the science tell us? We're the largest county. We have enormous responsibility for each other, and each other is 10.3 million people. And we have to often act, prudently to make sure that we are not taking on unnecessary risk, which was why we went forward very quickly once we hit substantial transmission with an indoor masking requirement. And I think it was obviously, I think it's the right thing to do. I did at that point. I certainly do now. And I think other counties are definitely encouraged by the state that has made a strong recommendation for indoor masking to adopt similar mandates should their conditions warrant it. And, I have a lot of confidence in the county health officers and with the state's partnership that people will look at our data and make decisions, knowing that, certainly it helped here in LA County get us back to a slower rate of increase among our cases. Tim, I think we have time for just one more question.
Great, we'll go to Ryan Carr with Daily News.
Yay, thank you, doctor, appreciate it.
I know we're really tight, but I feel bad because I talked for way too long. So go ahead.
Okay, well, I'll try not to with your too much here, but thank you again. Booster shots. I just wanted to kind of get a question in on that and get a sense of whether, that's something you foresee in the near future, and how that interplays with just the effort to get more people a first dose now, and whether or not that could actually be sort of delaying the effort to distribute booster shots, and of course all in the context of, I think it was WHO that requested that some countries kind of lay off the booster shots for the moment. So anyway, thank you.
It's a great question, Ryan. We're going to defer, as we have from the beginning, to the FDA and their scientific panels, and CDC and their scientific panels, to make decisions about how to most appropriately use the 3 vaccines that are available. They've got the teams there that look at all of the data around vaccine efficacy. They both get additional data that comes through the clinical trials from each of the manufacturing companies, but they also have the benefit of getting the real world data that every county health department is collecting, as is the Center for Disease Control, to evaluate the efficacy and the safety of the vaccines. And in this country, we should all be proud of that expansive system and let the FDA look at that information. My understanding is they'll be looking at it at, I think, around August 14th. The information that's being submitted by the manufacturers, the information that they've gathered, as well as information from clinical studies. And then they'll be issuing their guidance on when and who it may need a booster shot. I think until they complete that full assessment, we need to just wait. And I know that, it's hard. You see Israel is doing it. I think it's Germany. I think it's the UK. But we have a system in place here that allows us to have an independent review of manufacturing data that comes from the manufacturers. And I think that's an important part of this process. I also think we are part of the global world, and in this instance, we've seen firsthand how what happens in different countries affects what happens here in the United States. So there is a laudable goal that we're all working towards, which is getting vaccine coverage across the entire world, and that helps us all prevent particularly the emergence of dangerous variants. So, I'm going to rely heavily on the FDA. We're going to align fully with their what they recommend and allow for appropriate use for these vaccines. But thanks for that question. And with that, we'll see you next week. And if we didn't get your question, please go ahead and just submit it to our communications office, and we'll get back to you today. Thanks a lot, everyone.
Great, thank you. And our remarks in Spanish will begin in just a couple of minutes.